Welcome to Practically Perfect Presents Pelvic Health Building Blocks. This presentation was written and presented by Maura Plucino. I am a physical therapist. I have my doctorate in physical therapy from Stockton University, and I'm also a PRPC, which means I'm a pelvic rehabilitation certified practitioner. A little introduction of myself. I am a human. I am a mother of a teenager. I am a physical therapist and graduated in 2009. So I've been a physical therapist for quite a bit of time at this point. I joke that I'm a chaos coordinator. If you see a kitten or a puppy run through, I foster kittens. We also have a household kitten and puppy, and they are joining me on this adventure. I'm actually going to show you right now. This one right here is trying to be part of our presentation. This is Mata. She's going to get adopted soon. So if you see any babies popping by, that's why. And I apologize in advance, but we are the chaos coordinators here. And I wanted to give you a little background on my pelvic floor journey. So a lot of times patients come in and go, oh my goodness, you couldn't understand what I'm going through. No one's ever had this happen. I must be the only one. And that is simply not true. Pelvic floor dysfunction happens in a lot of people. I think a lot of different things happen to different people. So a lot of the statistics are like 1 in 4. But if you add up all those 1 in 4s, it's probably more like 50% to even 75% of people experience some sort of pelvic floor problem in their lifetime, whether that's associated with teenage years, with pregnancy postpartum years, with going through menopause, with prostate issues, and just overall aging. You're likely to experience some sort of a pelvic floor thing in your life. And a lot of times people don't understand that things fall under the realm of pelvic floor physical therapy. So my journey with pelvic floor physical therapy or pelvic health in general, because I actually never did pelvic floor physical therapy, I just treated myself, was started out probably when I was a little kid. I had to pee all the time. I was a very frequent urinator. I would always have to go to the bathroom. And the funny thing is my grandmother had pelvic floor dysfunction. And so whenever Gigi was going to the bathroom, I would just go with her. And I thought that was completely normal. I had some bedwetting issues. I definitely had some constipation issues. And then when I got to be a young adult and started trying to be sexually active, I could not figure it out for the life of me. I didn't understand how people had sex. I didn't understand why people would want to do that. I didn't understand how people got pregnant because I didn't know how they did sex long enough to get pregnant. And I also didn't understand how people got accidentally pregnant because sex was so uncomfortable. I was like, well, you're definitely very purposefully doing this to try and get pregnant. So I definitely had some issues there. And I mentioned it to my healthcare providers, and they kind of be like, you're 18, you're 19. Why do you have to have sex? Oh, are you trying to get pregnant? No. Oh, we don't really care. And I had providers be like, oh, do you drink a glass of wine before you try and do it? Oh, have you tried lube? Oh, maybe you don't like your partner. Maybe you guys are having problems. And it was really very dismissive. And so I kind of gave up on it for a while. And then I saw a pelvic health provider that was a specialist in pelvic health and pain because my mom saw that provider for some issues that she had been having. And that therapist went to go put the speculum in me and saw me go and jump off the table and said, oh, does this hurt you? And I was like, yeah. She started asking me questions and she was like, is sex painful? And I was like, yeah. And she's like, is pooping hard? And I was like, I don't know, talk to me about pooping. And so she describes what normal pooping is. And I was like, yeah, I don't do normal pooping. And then she was like, do you have to pee all the time? And I was like, yeah. She's like, do you get up to pee in the middle of the night? And I was like, yeah. She's like, do you get frequent UTI symptoms? And I was like, yeah. And so we realized that I have a really tight, high tone pelvic floor. Um, if you join the Practically Perfect family, you'll hear me talk about the Tiny Vagina Club. And that's just kind of like a tongue in cheek way to talk about people who have tighter pelvic floors than the average person. So that was my pelvic health journey there. That doctor actually really helped me to do my own pelvic floor physical therapy for myself. And I was able to return to having a comfortable pelvic health life, including my sexual function, my urinary function, and my bowel function. And then, years later, I got pregnant and had a baby and ended up having to have a C-section. So I got to see the pelvic floor world from induction through C-section. So I got to see that. And then I had a child who also had pelvic floor issues. So I have a lot of experience on a personal side with pelvic floor things. And I also just have always been that person in college and even in high school and in adulthood who, if you have a question about pelvic floor or sex or birth control or babies, I am probably the person that you're asking those questions. So that's kind of my history and who I am. If I'm driving you nuts at this point, then I'm probably not the therapist for you. But if you're like, oh, this girl seems like she knows what she's talking about, and I could totally have a conversation with her, then let's keep going. So, what is the pelvic floor? That is a question I get all the time. People will come in and go, I can't really get on the floor to do exercises. So, what is the pelvic floor? And I am going to pause here for a second because my puppy wants to go outside and go potty. The pelvic floor is very complex. And so it is the muscular base of your abdomen and it attaches to your pelvis. And some people talk about how it's the basement of the core. And there's an inner pelvic floor, an inner core, and an outer core. So the inner core provides stability for when you're, standing in your posture or you're sitting and you're not falling off of a chair. And then your outer core provides movement. So it lets you move your arms, it lets you move your legs, it lets you do things like pick up your baby or walk your dog. It helps you have stability with your movement. And your pelvic floor is made out of muscles, ligaments, and fascia that give support to your internal organs. And so here's a picture. And so you can see we have our back with our back muscles, we have our diaphragm and our rib cage, we have our abdominal muscles, and we have our pelvis and our pelvic floor. And those guys all have to work together in a pressurized system like a can of soda or a bottle of water. And so if something happens up here, it affects down here. If something happens here, it affects here, here, and here. And so this is where people are like, I don't know where these problems came from. And I'm like, well, I do. So as we're going through life, maybe we have some pregnancies, maybe we have an abdominal surgery, maybe we injure something like our back or our hip. Maybe we have some sort of cardiopulmonary thing like a heart murmur or asthma. And all of those things affect our abdominal canister. And unfortunately, your poor little pelvic floor is at the base of all of it and gets the brunt of what's going on there. So that is our abdominal canister. And so basically, any pelvic floor specialist should really be an abdominal canister specialist, which means we should be really good at looking at your back, at looking at your belly, at looking at your diaphragm and your rib cage, and then also looking at your pelvic floor. And so sometimes people come in and they're not super comfortable with the idea of me looking at their pelvic floor. And I'm like, well, that's good because there's three other areas that we can look at and clear and work on before we even need to take a look at your pelvic floor if you're not comfortable. What does our pelvic floor do? It has 5 functions and they're called the 5 S's. So it's support for our internal organs and our internal organs and our body. It does sphincteric control. So it keeps pee and poop inside your body or helps pee and poop get outside of your body. It is responsible for sexual function. So if you are a fan of orgasms like I am, it helps you to have sexual function and be able to engage in sexual activity. It provides stability. So it stabilizes your pelvis. It helps stabilize your ribs and your diaphragm. It helps stabilize your spine so that you can move throughout your day. And it's also a sub pump. So it helps you get out things like pee and poop and vomit and gas from your body so that you're not bloated, so you're not keeping something like food poisoning inside of your body. So it does those 5 things, and those 5 things are very important in your everyday life. This is how everything fits inside, okay? So all of those internal organs are really smushed in there, okay? So this is just showing you your digestive tract. So, you have your esophagus coming down, things going to your tummy. The food goes from your tummy to your small intestine, small intestine, then large intestine, and then comes out. I was checking myself. It's Saturday morning and I worked a hard week, so sometimes have a little trouble with, remembering anatomy, but don't worry. So this is how things fit inside, and I'm giving you 2 different views. So I try and be as inclusive with my language as possible, but in the medical community, there's going to be kind of the male pelvic floor and the female pelvic floor. I prefer to say things like the penis owners or the vulvovaginal owners, but sometimes that gets confusing for people who are not as used to inclusive language. So I have a view here of if you have a penis, that is the view right over here. And that is the view showing there's the bladder, then there's the prostate, and then there's the urethra coming down, and the urethra goes to the tip of the penis, and that's how urine gets out of the penis owner's body. And then the picture on the right-hand side shows you a vulva vaginal owner. And so there's the bladder, and then there's the uterus and the vagina coming down, and then there's the rectum. And so that's how it all kind of fits in there, but the organs are all kind of smushed and stacked. So when I talk about like the bladder in a vulvovaginal owner, there's the bladder, and then the uterus sits on top of it, and then the intestines sit on top of that. And so they're kind of all smushed together. I always joke the uterus sits on top of the bladder like Batman, just kind of sits on top there with its little wings out, which are the fallopian tubes in the ovaries. And again, when you come in for pelvic floor therapy, we talk about this in reference to you and your symptoms. This is just an overall view. So we're going to talk about a word called the perineum. The perineum is, oh, I put in here. So vagina. So it's hard to say some of these words: vagina, perineum, scrotum, testicles, penis. They're hard to say for some people. And so practicing that can be really liberating and opening. And so I want you to get used to calling things what they are. One of my pet peeves is when we teach little kids how to call their pelvic organs something that they are not, like a cookie or a chichi or a pee-pee or a, I don't know, my daughter once called it a pee butt, and I was like, oh, heck no, it is a vulva. It is a vagina. We do not call that thing a pee butt. In a nice mommy way, but we want to make sure that we are calling the things what they are, because then it empowers our kids, and as they grow into teens and adults, to know their parts and to be really knowledgeable and not to have shame around those things. And also just, if someone comes in and tells me their vagina hurts, and then all of a sudden I'm like, oh, actually that's your clitoris that's hurting you, that makes a big difference in how we treat things. And so I always want to make a point for us to know where our anatomy is. So this is a perineum of a vulvovaginal owner. And so you can see at the top, there's the pubic bone. We have the clitoris, and the clitoris has like a little hood that goes over her to kind of protect her and help her feel good. And we have a urethra, which is our pee hole. We have our labia majora and minora. Those are kind of the vaginal lips, or the vulvar lips. We have the vaginal opening, which is called the introitus sometimes. And then in between the anus and the vaginal opening is this area called the perineum. Or the perineal body. And so this whole area can be like referred to as the perineum, but the perineal body is that area between the vaginal and anal openings. And so it's really important to know what your perineum looks like, because a lot of people have never taken a look, and then they'll come in and be like, I think there's something wrong. And I'll be like, okay, what's different? Well, I don't know. I don't really look down there. And I'm like, okay. Everybody's different colors down there. Everybody has different sizes and shapes of labia or testicles. That's just how we are. So this is the perineal area from that perspective. And unfortunately, I don't have a testicular penile version of the external, but don't worry, I have the internal. So these are the pelvic floor muscles. Again, this is a vulvovaginal owner. And so we have muscles that are close to the skin, and we have muscles that are deeper down under. And the ones that are closer to the skin are in charge of, a lot of times sphincteric function. So keeping pee and poop in, and also letting things go in and out. And also these are ones that are part of penetrative intimacy, if we're trying to penetrate intimacy, or even speculum exams, putting in tampons, putting in menstrual cups or discs. These are the ones that help control that usually. And then we have a deeper layer, which is more of the supportive section of that. We have a urogenital triangle, which is kind of the front, the top pieces that controls pee and sexual function. And then the rectal triangle controls poop and also is a lot of support for our pelvic organs and our body. Here is a penis owner's view. And so you can see that those muscles that kind of control the vaginal opening control the base of the penis, the shaft of the penis. So again, they're still helping with controlling and closing that penile, that urethra in the penile shaft to help with urinary continence. And they're also helping with sexual function. So they're helping to get a penis erect, help keep it erect. So that is our external perineal anatomy. So why do we care about our pelvic floor? Well, I mean, I care about the pelvic floor because I think that sexual function, urinary function, and bowel function are really important parts of activities of daily living. But let's talk a little bit more about why we care. These are our little internal organs, and so they all stack and fit inside of each other. So we have our intestines on top of our rectum, on top of our bladder, and then if we're a vulvovaginal owner, on top of potentially our uterus, unless we've had a hysterectomy, on top of our urethra, and then it's going down into our vulvar opening. And if we have a penis, same idea, intestines, rectum, bladder, and then we have our prostate and we have our penile tissues and our scrotal testicle areas. So these tissues are not good when they're uncomfortable. No one wants to have pain in their ass. No one wants to have pain in their testicles. No one wants to have sharp shooting pains into their vaginal opening. And so we care about our pelvic floor because those things can happen during certain injuries or events in life. Our bladder. So let's talk about some healthy bladder habits and tips. Our bladder should normally go about 5 to 8 times a day. And we should be going about this slide says 3 to 4 because that's what the literature says. But I feel like the bladder should empty every 2 to 4 hours if we are well hydrated. How much fluid should a person be having in a day? About half of your body weight in ounces, as long as that's okay with your medical provider. So if I weigh 150 pounds, I should drink about 75 ounces of liquid a day. But that it could include if I have soup, if I have a smoothie, if I have, something that's very liquidy, that can be included in that fluid intake. Coffee and tea that is caffeinated, like my cup of chai tea that's in my evil queen cup here, that doesn't count towards my fluid intake because it's caffeinated, and caffeine is a diuretic and also dehydrates us. We want to be going to the bathroom no times per night unless we are over 75. But the literature says 0 to 1 time a night because it's including those people who are 75 and older. I like to talk about the 8 Mississippi rule. So 8 Mississippi means when I start to pee and pee comes out of my body, it's like 1 Mississippi, 2 Mississippi, 3 Mississippi. I can pee, and a full bladder is about 8 Mississippis. So if I go to the bathroom and like 3 Mississippis comes out, and I felt the urge to go, my bladder was a dirty liar. If I am like, oh, I'm going to Target, and I don't want to have to pee in Target, and I go pee just in case, and then like 3 seconds of pee comes out, it wasn't a great pee. So I want my pee to be in that 8 second range. If I'm peeing and like 30 seconds is coming out, that means I waited too long and my bladder was too full. That happens to like sometimes my teachers or nurses who hold their pee all day long and they hold it for like 8 hours and like, I pee like a racehorse. And I'm like, that's not really a great thing, because that overstretches your bladder and can cause problems long term. We want to drink, again, 6 to 8 glasses of non-caffeinated, non-alcoholic, non-carbonated beverages a day. It's not saying you can't have the other things, they just don't count towards your fluid intake. So bladder volumes, your bladder can hold about 550 milliliters, which is about like a venti cup of coffee. And so we have 3 sensations for when we have to go to the bathroom. We have, I could pee, I would really like to pee, and I have to pee so bad I'm going to pee in the trash can. And we want to be going to the bathroom when we have that second urge of like, I really could pee. So some people are like, if they have a history of UTIs, maybe they're like, oh, every time I feel even the slightest urge to go to the bathroom, I'm going to go so I don't get a UTI. And that doesn't really do your bladder any favors. So we really want to be going when we feel like a strong urge to go. And then we want to confirm that that urge was correct by counting how much pee comes out. So that is our bladder volumes. And so these days, having an active nightlife means getting up 3 times a night to pee. We don't want to be getting up to pee at night. So some ways that we can prevent that is by stopping drinking about 2 hours before bedtime or just sipping fluids closer to bed. Not drinking a bunch of bladder irritants in the afternoon. So not doing bubble waters, not doing a whole bunch of caffeine, maybe having your glass of wine or your alcoholic beverage a little earlier in the evening, like with dinner instead of as an afternoon drink or after dinner drink. And also just making sure that you're avoiding right before you get into bed. We're going to talk about the bowels. If you want a good laugh, my daughter and I, when Practically Perfect first started before it was a brick and mortar, we used to have fun making all these different organ videos. And there's the one called The Bowels. It's like organ jail and it's the bowels. And I'm like, the bowels on the bowels. So if you want to laugh at me, that is a great video to go and watch. It just talks about kind of when your bowels are misbehaving. But our bowels, if our bowels aren't working well, first of all, they're holding a lot of literal garbage in our body, and it can be really uncomfortable to be constipated. It can be really uncomfortable to strain. We don't want to get hemorrhoids. We don't want to have anal fissures. We don't want to have a lot of bad things that can happen with our bowels. And also, we don't want to be full of garbage because that can lead to bloating and discomfort. So healthy bowel habits include anything that's easy to digest is good for your pelvic floor. Cooked foods are always going to be easier to digest than raw foods, and having small, more frequent meals can sometimes help your tummy to feel better. Our poop is so important. So there's this awesome person named Sarah Reardon, and she's the vagina whisperer, and she is like the leading social media person for pelvic floor things. And so when I started doing pelvic floor therapy, I was like, I'm going to be the vagina whisperer. I'm going to be super cool like her. And then I learned quickly that I am the poop queen. And I spend all my time talking to people about poop because we can't fix things in the bladder or the vagina until we fix our poop. And so I spend a lot of time talking about poop, and I am of the belief that you are constipated until proven otherwise. And so I want to talk about poop a little bit here. So we should poop pretty much every day. And when we poop, it should be that type 4 or 5 where it comes out soft and smushy, like soft serve ice cream. It should not be hard. There should not be rabbit pellets. It should not be big enough to clog the toilet. And even if you pooped those one type 1 through 3 multiple times every day, I would still bet you that you were constipated. So we really want to be very careful with our bowel movements. And I can't tell you how many times I have patients come in and be like, I'm not constipated. I poop every day. And then we get further into the therapy, further into this conversation. And I'm like, can you just bear with me and see what happens when we treat your poop? And lo and behold, they start pooping differently and go, oh my goodness, I didn't know this is what poop was supposed to be like. And I was super guilty of this. I was also super guilty of this with my daughter with her pelvic floor issues. So I'm here to tell you that I am a converted believer in that your poop really affects how your pelvic floor is working. People who have frequent UTIs, almost always frequent UTIs, it's stop blaming sexual activity on UTIs. It's usually constipation. Bedwetting, almost always constipation. Urinary frequency and urgency and overactivity of the bladder, almost always constipation. So if we fix poop, we have a lot of positive things happening for our pelvic floor. Fiber is my favorite. If you know me, you know that I choose foods based on fiber. I don't look at calories. I don't look at nutritional facts aside from how much sugar is in something and how much fiber is in something, because fiber helps us to balance our weight. It helps us balance our fat. It helps us balance our cholesterol, and it helps us poop better. There are different types of fiber. There's soluble fiber and insoluble fiber. And so soluble fiber is, if I put it in a glass of hot water, it will turn into a gelatinous goo, like oatmeal, grits, flaxseed, chia seeds, even some bread. Those things will turn into like a gelatinous goo. And then there's insoluble fiber. So if I took a cup of hot water and put a carrot stick in there, it's going to kind of stay looking like a carrot stick. If I put corn in there, it's going to stay looking like corn. Insoluble fiber. It's kind of like what our grandparents referred to as roughage. So common pelvic floor issues. We're just going to breeze through these because, again, this is not a PT treatment. This is just kind of a courtesy. Here's what pelvic floor is in case you're wondering and in case you're not sure if our practice is the one to work with. So diastasis recti. There is a ton of fear mongering about this on the internet. It does typically relate to people who are birthing babies, but it can happen to people who have a little bit of a beer gut or have had abdominal surgeries. And it's actually really common in children, especially preemies. So it's not just a birthing mom thing, it can be anybody. And so I check all of my patients for diastasis recti because, like, this can also make you have back pain. So we have two muscles called the rectus abdominis muscles. I always think they sound like a dinosaur. And then in between, we have something called the linea alba. And so there can be a lot of pressure on these rectus abdominal muscles, and they can pull and separate that linea alba. And that linea alba is connective tissue. It's like a perforated line in our tummy. Once it's torn, it's torn. So it can't go back. But we can teach those muscles how to work better together so they're not staying open and creating an open space. This is something your pelvic floor therapist can screen you for. Sometimes people will see doming or coning of their upper belly area, and they're like, oh no, what's that? And that's probably a diastasis. It's something that can be fixed in therapy. It's something that does not usually need surgery. It is technically a hernia, but it is a safe hernia. And it's really just something to talk to a pelvic health specialist because, again, we're canister specialists. So please come and see us if you're experiencing this. And then leakage. No one should ever leak, okay? Never, ever. It's never okay. Even if you laugh, even if you cough, even if you sneeze, even if it's the funniest joke in the whole wide world, even if you had to pee for 8 hours and you were holding and holding it, you should never have to leak urine, okay? Never, ever. So to pee or not to pee, that is the question. Some people have urgency and frequency and feel like they have to pee all the time. Definitely something we can help with as well. So there's different types of incontinence. So you can have stress incontinence, which is I cough or I sneeze or I laugh and pee comes out. We can have urge incontinence, which is like I feel the urge to go, and before I even get there, pee is leaking down my legs. There's overactive bladder, which is I feel like I have to pee all the time, all the time, all the time, and that can have leakage with it. There's functional incontinence, which is like I had my knee replaced and I felt like I had to pee, but I couldn't get out of bed in time to get there. Or I'm super pregnant and I'm stuck in my bed and I can't get out of bed and fast enough for me to get to the potty. There's overflow incontinence. So I've held my pee all day long because I'm a teacher and it's, 8 hours later and I get the urge to go and I just can't get there and pee just starts coming out. And then there's transient incontinence, which is I got COVID and I've been coughing for 3 weeks and now all of a sudden I'm leaking pee and I didn't usually have that happen. Or I'm pregnant and all of a sudden I sneeze and pee comes out. Or I just had a baby vaginally and all of a sudden I like leak when I have urge to go to the bathroom, which I never had before. Pelvic floor therapy can help with all these things. Again, surgery does not have to be the first option. A lot of times just some education, some habit changes, some coordination of the core and pelvic floor can make a huge difference. Pelvic organ prolapse. Again, we're not going to go too far down this rabbit hole, but that is something that happens a lot of times to people who have had vaginal deliveries. I like to refer to pelvic organ prolapse as pelvic organ sagging. The reason I like to do this is because when we are pregnant, when we have babies, our bodies change. We get bigger breast tissue, we get stretched out tummies, we get stretched out thighs. We are growing a human and we are going to change. And so after we birth that baby, we tend to sag, right? Our breast tissue sags, our belly tissue sags. And so it would be common and normal for us to have some sagging of the pelvic organ tissue as well. And so I feel like when we use the word pelvic organ sagging, even though sag, it has certain connotations. It's not as scary as the word prolapse. Because prolapse, you're like, oh my God, something's falling out of my vagina. Oh my God, something's falling out of my butt. And if it's falling out now, what's going to happen? It's probably going to get worse, right? And I'm like, no, it's not going to probably get worse, especially because you're here with us in pelvic floor therapy. But we can have different things that can prolapse. And so we're going to just briefly talk about that. So the vaginal canal, which is where prolapse typically happens, the vaginal canal is like a stretchy sock, okay? It's typically just kind of hanging out. And so when a baby comes through, it comes through and it stretches out that vaginal canal. And it can have stretch marks in it, just like our tummies get stretch marks or our breasts or our thighs get stretch marks. And so those stretch marks will be in there. And the vaginal canal is super cool. So it goes back to being the same size. It goes back to filling in the same space, but there could be some thinning of the tissue and some stretch marks. And so then what happens? I don't know if you remember science class. I will never forget Mr. DeMarco in freshman, sophomore science class, where pressure goes from high to low. So our vaginal canal is not really ever doing anything. Our bladder is filling with urine. Our bowels are filling with poop. And so there are higher pressure systems than my vagina that's just kind of hanging out in here, waiting for a tampon, waiting for something to come and be put in or for a baby to come out. And so sometimes the bladder kind of pushes into the vagina and sags a little bit, or sometimes the rectum pushes into the vagina and sags a little bit. And so that can be called a rectocele, or a rectum pushing in is a rectocele, or a cystocele is where the bladder is pushing into the vaginal canal. And so that it can be a prolapse, and that can sound so scary and be so terrifying and feel like, oh my God, I could never let my partner look at that. Oh my God, my vagina is broken. And really, it's not. It's super common. It's something we can be worked on. And actually, pelvic floor therapy from the research shows that if you do pelvic floor therapy, there's different grades of prolapse. There's grade 1 through 4. And so pelvic floor therapy can usually improve prolapse or pelvic organ sagging by 1 grade. So if you come in and you're a grade 2, we can get you to a grade 1. If you come in at a grade 1, we can get you to like negligible, almost to 0, which is super reassuring and helpful. So if you think you have pelvic organ prolapse, or you're not sure, or you're feeling some pelvic heaviness or some low back pain, that's definitely a time to see a pelvic floor provider. And just knowing that there's hope and that it's really common and that's really something that can be helped can be really reassuring for you. Pelvic pain. No one wants pelvic pain. No one wants pain with sex. No one wants pain with peeing. No one wants pain with pooping. No one wants just pain in their body when they're sitting there. So we want to address pelvic pain. There's a lot of features and a lot of parts of pelvic pain. So pelvic pain can be because of muscles, it can be because of nerves, it can be because of skin, it can be because of surgery, it can be because of scar tissue, trauma. Like there are so many pieces to the puzzle of pelvic pain. And when I talk to patients about this, I talk about how my dining room looks during the Christmas season, because my dining room starts to stack up with Amazon boxes, and one comes here and I throw it in there, and another one comes here and I throw it in there. And all of a sudden my whole dining room is full of Amazon boxes. And then I wrap all those presents and I put all those boxes in my garage to go out to recycling. And I'm like, oh my God, how am I going to get rid of all of these cardboard boxes? There's so many cardboard boxes. And I'm like, one at a time. I'm going to take one box at a time. I'm going to fold up 2 or 3 here, get rid of them, and my garage will be back to normal after a couple of weeks and some recycling periods. And that's kind of how pelvic pain is. You know, we fix 1 or 2 pieces, we fix another 1 or 2 pieces, we address another 1 or 2 pieces, and all of a sudden our pain is so much better. This lovely picture here by my illustrator, Elizabeth Wolf, is the lumbar nerves. So the lumbar nerves, so, you know, people who have back pain, they can create some pelvic floor distress. So they wrap around into the inguinal area, into the groin area, into the vulvar, testicular, penile areas. And it can cause the symptoms of pelvic floor dysfunction, even if we're not necessarily having a pelvic floor thing. Or it can be a combination of that you have a back problem and a pelvic floor problem. So definitely we are the specialists in this area. And then intimacy issues. We want to be able to have sex or intimacy whenever we want to, okay? Whenever we are consenting and want to be participating in that, whether it's with a partner or by ourselves, we want to be able to have the sex life or the intimate life that we want. And when I talk about intimacy, I'm not just talking about penis and the vagina sex or intercourse. I'm talking about all of the things. This can include outer course, it can include using fingers, it can include using toys, any type of genital. We are all inclusive here at Practically Perfect. We don't really care what your sexual practices are. We care that you can do the things that you want to do. And so some things that can make sex or intimacy difficult are decreased lubrication, hormonal changes, muscular tightness, scar tissue, sometimes joint dysfunction, weak muscles or imbalanced muscles, and nerve problems. And pelvic floor physical therapists are the experts in this. Are you picking up what I'm putting down? We know all the things when it comes to this area. So we want you to get well enough to have sex again soon. We cheer when you come in and you've had a history of painful intercourse, or you haven't been able to have intimacy with your partner, and you come in and tell me, I was able to do XYZ, or I had an orgasm. You will see my happy dance awkward moves there, because I will be so happy. Sometimes I have to apologize for my exuberance because I get really excited about people having comfortable sex because I have a history of having painful intercourse. Therapy for the pelvic floor. I think I've talked about this just a little bit so far. But this is just another joke. I love these some e-cards. Sorry, physical therapy is the most action you've had in months. I want you to be able to have action at home, whatever kind of action that is, without me as your physical therapist having to do that with you. So PT helps. We help with muscle tension. We help with range of motion. We help with muscle weakness. We help with scar tissue. We help with posture and coordination. We help with any musculoskeletal problem. And we are the educators on how all this stuff works together. So we can help that way. We can help those musculoskeletal impairments. Those include weakness, posture, breathing, if you're deconditioned, if you have nerve issues, if you have mobility issues, if you have range of motion issues. We are your go-to people. Our practice is super cool because we now have 4 therapists, and we have 3 pelvic floor therapists and 1 orthopedic manual specialist. And so we are like so holistic because we have come from this really rich background of neuro and pediatrics and orthopedics and myofascial and yoga and just all of these things. And all of our practitioners bring that together and we work as a team to help our clients. So that's really a super awesome component of our practice. So what is a pelvic floor PT? We are the specialist in the abdominal canister. We have done extra training and extra classes in learning how to do pelvic floor muscle assessment, pelvic floor muscle treatment. We've learned nerve glides. We've learned joint mobilizations. We've taken extra continuing education on bowel stuff and bladder stuff and pediatrics. And so we want to be able to help you with all of the things. I spent my first 3 or 4 years as a pelvic floor therapist, probably taking 3 to 4 continuing education classes a year. Each class is about 20 to 30 hours. So I've spent hours doing pelvic floor things. And then once I felt like I had an education and was really good at what I was doing, I also jumped into teaching. So I also help to teach other practitioners how to do these awesome things and this awesome work because everybody has a pelvic floor. Pretty much everybody needs pelvic floor at some point in their life. And so I just want all the practitioners to be out there doing this with them. So I just wanted to talk a little bit about what a pelvic floor exam looks like and an evaluation and day looks like, because people come in and they're like, oh my God, I don't know. And so I actually wrote a book called Pelvic Health 101, a visual tour of your pelvic floor. It's on Amazon. And that book, we go through chapter 1 of that book and talk about what is the canister, what is the internal organs, how does that relate to what you're experiencing and have going on. And then we talk about your history. So what brings you in? What's going on? What are your goals? Because your goals and my goals may be different. So you might come in and say, I haven't had sex in 10 years, but I'm really having a hard time wiping. I wipe and wipe and wipe and poop keeps coming. And I'm like, do you want to go back to having sex? You're like, no, I want to wipe and not have poop keep coming. And I'm like, okay, let's work on that. And then you might later fix that problem and be like, now I want to work on sex. And I'm like, okay, cool, because I love to work on sex. We also are all about wellness. I'm getting digressing here. So pelvic floor exam. We are going to talk about what your concerns are, what your goals are, and how we can help you. We are going to assess the things. So we are going to look at your back. We are going to look at your diaphragm and your rib cage and your belly if you feel comfortable. We are going to talk to you about if you're comfortable doing a pelvic exam. A pelvic exam can look a lot of different ways. We can just look at the outside. We can do an internal exam. We could just assess from the outside over your clothes. We always like to have more information, but we don't have to do that. And I always feel like it's a comfort level thing. Some people come in and they're like, I need you to look in my vulva and in my vagina because this problem has been bothering me for so long and I need you to freaking figure it out. And I'm like, let's dive in. And then I have some people who are like, I think I need to get to know you a little better and hear about the other things you have to offer me before I feel comfortable having you assess my pelvic floor. And I'm like, okay, that is fine too. So pelvic floor exam, if we do an internal exam, we give you privacy. We have you undress from the waist down. We have you lay down in a comfortable position, usually it's starting out on your back. And we don't use the speculum or stirrups. We are typically using gloved fingers, and we would palpate on the outside of the areas first and see if anything outside hurts. And then if you're comfortable, we'll cover you back up. We'll change our gloves so we're not getting any germs where they don't belong. And we would do an internal exam using one little gloved and lubricated finger. My patients always go, this is the most gentle exam that I've ever had by a medical provider. And I'm always like, thank you. I work really hard for that. So it's my one little gentle finger. We go at your pace. I tell you everything. All of our providers tell you everything every step of the way. And we're looking at, can you contract your muscles? Can you relax your muscles? If I'm in a canal, how is that tissue feeling? Are there areas of tightness? Are there areas of weakness? What's going on in there that's causing these symptoms? We also are the experts at assessing for prolapse or pelvic organ sagging. So we'll look and see, is there anything happening there? Do we have the vaginal, is something bulging into the vaginal canal, like the bladder or the bowels? And we're checking and putting all those things together. So we do that assessment. We give you privacy and some baby wipes to get rid of our lube and stuff. And then we have you get all put back together and we come and we sit and we talk to you about what is going on with your body. And we create this plan of care with you that is just for you and your provider, or you and your providers in our practice, to help you get better. People always ask how often we need to see you. We typically see you once a week. It's typically our frequency, sometimes every other week. And we give you homework and we give you education. And I would say the average is about 6 to 10 visits, depending on what's going on. If it's just like a simple kind of incontinence thing, that's going to be more on the side of 6 visits. If it's more of a pelvic pain, intimacy issue, it might be more like 10 or 12 visits. Pelvic floor therapy is covered by your insurance. We are an in-network provider, which means that we take most insurances because we want you to get this care. We want you to have access to this care. So that is how a pelvic exam looks. So I don't like to talk to people on the phone. I love you so much. I will talk to you on the phone. I, seem like I'm bubbly and outgoing. I'm actually a secret introvert. I'm like an extroverted introvert. So I'm great one-on-one. I don't really love to talk on the phone, but I will always text you back. And if you have specific concerns, I will always give you a call when I have a moment in my day from patient care and parenting. So, what we offer and why, I think we've talked a lot about this, but we offer one on one therapy. We also offer wellness baby classes. So, the other hat that a couple of my providers and I wear is that we were pediatric therapists in a lifetime long, long ago. And so, we offer baby classes. And so, you can definitely check that out as well. And we also offer in person birth workshops so that we have less trauma after birth, physically and emotionally. We offer online baby and birth classes because, again, some people can't get to our clinic or some people can't get out of the house, but we still want you to have that education and care. And we offer community workshops. I also have these awesome providers in my clinic that offer myofascial release, yoga classes, and just regular traditional massage, dry needling. Like we have a lot of other holistic providers, and we can always connect you with them as well. How you contact us. So you can contact us on Instagram. You can contact us on Facebook and TikTok. TikTok, I'm not always the best at answering, but I make really cute reels. You can text us, you can call us, you can send us a contact form through our website, you can email us. We are so accessible. We want this to be like an easy transition. We do not want you to have anxiety or nerves around joining pelvic floor therapy. We just want to be here for you. And if you're not sure if we're 100% correct for you, that's okay. I still recommend starting that conversation and coming in and just doing an initial evaluation because I cannot tell you how many times people come in and they're like, I don't know, I don't know, I don't know. And after we just even have a conversation and just talk about history and stuff that first day, they're like, I am so glad I'm here. And I'm like, I am so glad you're here too. But it's really the fear of the unknown is a huge thing in the pelvic floor world, just because you don't know what we're going to do. And informed trauma informed care is something that's kind of new and maybe lacking in some areas, but we are like totally here for you. So I hope you enjoyed our pelvic floor building blocks free little lecture here and that you just kind of learned about pelvic health. I know we talked about our practice in general, but if you are not local to us or cannot work with us, or I'm looking for someone who's a hands-on provider, but you don't live locally, there's something called Herman and Wallace Pelvic Rehabilitation Institute, and you can Google them, and they have a practitioner finder. And so you can go ahead and put in, where you live and what you're looking for, and they will help you to find that. I always recommend a PRPC, a pelvic rehabilitation certified practitioner, or someone who has done multiple pelvic floor continuing education classes. And so that involves, someone who has done a lot of continuing education and not just one pelvic health class. Have a practically perfect day. I hope that this was super helpful for you, and I hope to hear from you soon. Follow us on Facebook, on Instagram, on TikTok to find out all the fun things we offer. We'd love to have you join our email list. If you've been our patient, we'd love to have a review. Bye.